There is some new hope tonight for those with compromised immune systems as the Delta variant continues to spread.
Yeah, right now we're waiting to hear if the FDA is going to amend its emergency use authorization to allow those people to get a booster shot.
Yeah, this is something a lot of people want, especially with rising cases across the country and here in Indiana. Today, our state, take a look, reported more than 3,100 new cases.
In fact, we haven't seen a number that high since January 22nd. This is a pretty scary situation for lots of people, especially those considered with those compromised immune systems.
Yeah, so tonight our Mary Mills joins us with a look at what this development means for them.
I think we were all just excited and kind of relieved to see a path forward.
Jen Weber talking about transplant recipients like herself becoming eligible for a COVID booster shot.
I need all the protection I can get. I don't have reserve to take a gamble that I could survive COVID. I can't survive a cold. I can't survive a flu.
Jen, born with cystic fibrosis, has had 2 double lung transplants. She has treatment twice a month to fight rejection. Jen's among those with weakened immune systems. Though fully vaccinated, she never generated any antibodies. Word that a 3rd shot may offer even limited protection has her eager to roll up her sleeve again.
They'll tell me where to go and I'll be the first in line to do it.
In terms of the risks, the side effects were very similar than from the 2nd dose.
Dr. Nicholas Barros is a transplant infectious disease specialist at IU Health. He says while studies indicate a 3rd dose is safe for patients like Jen, it's hard to say how long the protection might last.
We do not know how much the protection will remain.
Jen knows even with a booster, she may not see much, if any, added protection. But just the chance at one more shot has boosted her outlook.
You know, that however you feel about vaccination, we've not been able to get vaccinated effectively if we want that. And so I think that's really what this booster is finally giving us, that hope and that opportunity.
Now, tomorrow, some CDC advisors plan to discuss booster shots for the rest of us. Right now, they are not planning to take a vote. The FDA would then have to grant full approval of the vaccines before they can recommend additional shots.
New tonight, we've learned that Indianapolis-based Eli Lilly will require all of its workers to get vaccinated against COVID. There's a November 15th deadline for employees in the U.S. and Puerto Rico. Also, Lilly released this statement saying, quote, "As a science-based company, we have thoroughly reviewed all the data and options available to us. We believe this decision helps keep our employees, families, and customers safe and healthy, and ensures we can continue making life-saving medicines for people around the world."
The Federal Department of Health and Human Services tonight is now requiring vaccinations. This only applies to workers who provide care for patients or whose work could put them around patients. So we're talking about 25,000 people.
The country's largest teachers union wants to see a vaccine mandate for teachers or regular COVID testing.
Yeah, the National Education Association represents about 3 million teachers. They've issued a statement saying it's clear the vaccine is one of the most effective ways to keep schools safe. And more central Indiana schools are making changes as these COVID cases go up.
Some Noblesville East middle schoolers are going virtual because of a COVID outbreak there. 118 8th graders in the Wake Forest team will learn remotely for 2 weeks.
In fact, there's a football scrimmage tomorrow that's been canceled, and some of the players on one of the teams have tested positive for COVID.
That's right, and starting Monday, Washington Township schools will require everyone in that district to wear masks regardless of vaccination status.